Today we are going to speak with some vegetarian athletes. About 2.5% of adult American athletes identify themselves as vegetarians. There are 5 different types of vegetarians, including semi-vegetarian, lacto-ovo-vegetarian, ovo-vegetarian, vegan, and macrobiotic vegetarians. Semi-vegetarians avoid some, but not all, animal-derived foods. Lacto-ovo-vegetarians drink and eat milk products as well as other dairy products, but avoid all meat sources. Ovo-vegetarians consume eggs but avoid dairy, meat, poultry, fish, and other seafood. Vegans avoid all animal-derived foods, while macrobiotic vegetarians avoid most but not all, and instead focus on the consumption of unprocessed organic food sources. Now let's meet our vegetarians.
Alright, my name is Sarah Neary. I'm 21 and I work out 5 times a week, and I'm a vegetarian.
Hi, I'm Angie Sanders. I'm 20 years old and I work out about 4 to 5 times a week for an hour in each session.
I'm Julia Westerman. I'm 20 and I work out for 4 to 5 days a week for like 60 minutes.
I've heard that, so I had a knee injury maybe like 2 months ago, and my doctor told me that because of my deficiencies in certain vitamins and stuff, it could be causing me to have weak joints, and which could be ultimately causing my knee problems.
I would say that I'm just mostly concerned about not getting enough protein because I'm a really picky eater and I don't like a lot of the alternative protein sources.
Because I'm vegetarian, I probably don't consume enough protein, which could be concerning for the fact that I work out, but other than that, I'm not really too worried about anything.
Recommends I take vitamin D supplements as well as calcium supplements. I don't always get to doing that, but I think that it would probably help me a lot because I also don't drink any milk or have like a big source of calcium in my diet. So I think that puts me at risk for osteoporosis, but I'm not entirely sure.
I really just kind of stick to my diet since I'm so picky, so like sometimes I'll eat a little bit more peanut butter on the days that I work out, but that's really about it.
On days that I work out, I try to snack on nuts to get more protein, but other than that, I probably don't change anything too much. I try and get enough iron from spinach because I'm not eating red meat, so that actually could be a concern. And I also eat a lot of peanut butter, and I have eggs in the morning.
Because you may be at risk for vitamin D deficiency, vitamin B12 deficiency, zinc and iron deficiency, as well as not obtaining sufficient protein. So now that you know that these are some possible deficiencies, is there anything that you might change about your diet?
I mean, I don't know. Do you have any suggestions as to how I could change my diet?
Yes, actually we do. Some good sources of protein are tofu, peanut butter, nuts, some beans, specifically lentils. For the B12, like we said, you're gonna have to supplement, vitamin D supplement, but you already do that. So, good stuff, you're on the right track.
Okay, cool.
I think that I'll definitely try to look more into the deficiencies that are possible and try to find alternative foods that I still do like.
Because I could possibly be low in those things, I feel like I should maybe go to the doctor to get some blood work done to see if I am potentially anemic. And I would also consider taking like a B12 supplement to try and help with that if it was necessary.
Once again, to reiterate, vegetarians are typically deficient in vitamin D, B12, iron, zinc, and tend to lack protein. More specifically, we found that the athletes we interviewed thought they may have been deficient in iron, calcium, and vitamin D. We recommended that the individuals either supplement or change their diet. For those deficient in vitamin D, we recommend fortified milk or cereals. Individuals on the lower side of protein intake can ingest soy proteins, nuts, and beans. For iron, individuals can benefit from dark green leafy vegetables as well as beans. Zinc and B12 can be obtained from milk or fortified cereals as well as supplementation. Without a change in diet or supplementation, these athletes and other vegetarian athletes could suffer from deficiency symptoms such as fatigue, disruption in function of GI tract, bone brittleness, and many other issues.